Clitoris itching. Main causes. Mild itching of the clitoris can occur due to an increase in sensitivity from sexual arousal or stimulation. Persistent itching that arises outside of sexual activity or does not go away may signal an infection or health condition. The clitoris is a small, round part of the female anatomy that sits above the opening of the vagina. It is very sensitive and has many nerve endings, so itching here can be particularly bothersome. Irritation. The clitoris is very sensitive and contains many nerve endings. When something irritates this area of the body, it may feel itchy. Irritants could include a certain material that the underwear comprises, for example, a scratchy fabric. Alternatively, it could be a new laundry detergent or soap. A person can try switching these products to see whether this solves the problem. Sexual arousal. During sexual arousal, blood flow to the clitoris increases and this organ swells up, which makes it more susceptible to irritation. Sometimes a person may feel temporary itching before, during, or after sexual arousal. This itching usually goes away by itself and is not a cause for concern. However, a person should look out for other signs and symptoms to make sure that the itching is not due to an infection. Bacterial vaginosis. If the levels of bacteria in the vagina become unbalanced, this can cause an infection called bacterial vaginosis. Doctors do not know the exact cause of bacterial vaginosis, but the following factors may increase a person's risk of getting the infection. Having sex, particularly with a new partner, having multiple sexual partners, vaginal douching. Bacterial vaginosis can cause itching of the clitoris and the area around the vagina. Other common symptoms include a burning sensation when urinating, pain or a burning sensation in the vagina, gray or white vaginal discharge, a fishy odor, particularly after sex. Anyone who thinks that they might have bacterial vaginosis should see their doctor for a diagnosis and treatment. Thrush, a vaginal yeast infection, which people usually refer to as thrush, can make the clitoris and other parts of the vulva very itchy. Other symptoms of a vaginal yeast infection affect the vagina and vulva and can include a burning sensation, redness and swelling, painful urination, painful sex, soreness, thick white vaginal discharge that resembles cottage cheese but does not have a bad odor. An overgrowth of yeast called candida causes these infections. People who think that they have a vaginal yeast infection should see their doctor to get treatment and rule out any other infections. People may be more at risk of getting a vaginal yeast infection if they have diabetes or high blood sugar, are pregnant, use birth control that increases estrogen levels, douche or use chemical sprays or washes in their vagina, have taken certain antibiotics recently, have a weakened immune system. Lichen sclerosus. Lichen sclerosus is a non-contagious skin disorder that affects the genitals. It can also involve the skin around the breasts, upper body and upper part of the arms. Although the cause of lichen sclerosus is unknown, experts believe that it might occur due to changes in hormones, genetics, damage to the skin through injury, having an overactive immune system. Lichen sclerosus affects females more often than males, and it is rare in children. It usually occurs after menopause. Along with itching, other symptoms of lichen sclerosus can appear in the affected area. This may include blisters, scarring of the skin, bleeding, small white spots that may grow bigger, patches of thin, wrinkled skin, skin that tears or bruises easily. A person should see their doctor if they think that they have lichen sclerosis. The doctor may inspect the skin using a microscope to diagnose the condition. Scarring of the skin from lichen sclerosis can increase the risk of cancer. People with lichen sclerosis should see their doctor every 6 to 12 months to check that any changes to the skin are benign. Persistent genital arousal disorder. Persistent genital arousal disorder, or PGAD, is a long-lasting sensation of a sexual arousal without any sexual stimulation. It is much more common among females than males. Symptoms of PGAD affect the genital area and can include itching, a burning sensation, throbbing, tingling, increased pressure in the genitals, pain, lubrication, contractions in the vagina, orgasms. The duration of symptoms can vary from a few hours to several weeks or even months, although the cause of PGAD remains unknown. Stress and anxiety may play a role in the condition. Certain activities such as being in a car or urinating may also trigger symptoms. People with PGAD may be more likely to have other health conditions such as epilepsy, Tourette's syndrome, or restless leg syndrome. Genital eczema. The symptoms of genital eczema can affect the vulva as well as skin around the anus and buttocks. People may experience itching, a red rash or sore patches on the skin, thin cracks in the skin, weeping, crusty or dry skin, a stinging or burning sensation, an allergic reaction to clothing, bathing products or medication can cause genital eczema. Sexually transmitted infection. Itching of the clitoris and genital area can signify a sexually transmitted infection or STI. Other common symptoms of STIs can include painful urination, frequent need to urinate, unusual vaginal discharge or odor, redness around the genitals, stomach pain, anal bleeding, sores around the mouth, warts around the genitals. It is best to see a doctor about any of these symptoms to find out what is causing them and to receive treatment if necessary. Vulvar cancer. Itching of the clitoris can sometimes be a symptom of vulvar cancer. Other symptoms depend on the type of vulvar cancer, but they can include an area of skin on the vulva that looks different than the surrounding areas. For example, it appears lighter, darker, or thicker. Skin that looks red or pink compared with the surrounding areas. A painful or burning sensation. Unusual vaginal bleeding or discharge. An open sore that does not go away. A lump or bump on the vulva. A change in a mole in the genital area. People should see their doctor if they notice any of these signs. The doctor will carry out a pelvic examination to check for any abnormalities.